Hi, I'm Tony from AMI-Quebec. I'm going to be hosting our conversation tonight about LGBTQ and mental health. With me, I have Viet and Hemat. And so I'm going to start by telling you a little bit about AMI-Quebec. We are a Montreal-based community organization, and we offer support for caregivers through support groups, podcasts, counseling, SOS Famille, and I'm personally the outreach coordinator here. I organize presentations to destigmatize mental health in the community, in the workplace, and to get people talking about it. With me, I have Viet. I'm going to have them, and Hemat. I'm going to have them introduce themselves and give you a little bit of who they are and what they do.
Thanks. So my name is Viet Tran. I'm a third-year psychiatry resident at McGill University. I'm a visible minority. I'm also a sexual minority, so I'm also I represent the LGBTQ plus community within the medical system, and I'm an advocate as well.
Hi, my name is Himit Shinhat. I am a retired senior civil servant. I was a director with the Department of Immigration for just over 30 years. And a lot of the work I was doing there was in human rights, a lot of it around refugee protection. My background before that was in community activism and arts activism. In my policy work, I've done a lot of work around human rights related to refugee protection. And as you can probably imagine, a lot of people that come to Canada to seek refugee protection are people who are LGBTQ, and they're from countries where they're subject to persecution or mistreatment of different kinds. In my work also, I took there were a lot of situations where I took responsibility for diversity and inclusion in the workplace. And one of the last things I did before I retired is federally, there was a program put in place called Positive Space. So I actually developed a series of training products for the immigration department, which were also used across government and other departments as well, to basically raise awareness around LGBTQ plus populations, both within and outside the government, and then also how to be a little bit more inclusive and then create spaces that are safer for people who have identities that are LGBTQ. On a personal level, I'm queer. I identify as queer. Married. I've been in a relationship for about 28 years now. We got married about 5 years ago. So, and I'm also an artist. That's the other thing, my other identity that I have. So since I've retired, I'm kind of going back towards that kind of identity and doing a lot of work reconnecting to sort of community art activism type projects in Montreal.
Great, thanks. So to get started, let's talk about what LGBTQ stands for. Who wants to go first? You guys, how about you guys want to do, each want to do a letter and hand it off? Do you want to do 3 letters each? What are you thinking? You'll start? All right.
And maybe you can
say however many you want and then hand it off.
Okay, so L stands for lesbian, G stands for gay, B, bisexual. T, do you want to finish? Because there are also other letters as well. So T would be transsexual and Q would be queer, but there are other ones.
Yeah, there we go.
Just in terms of, Himit says, looking at his list, this is actually from one of the workshops that I've done. So LGBT, you've covered those. Q also stands for questioning. So it's somebody who, I think if I look back on my own life, there was a period in my life where I wasn't really sure. So it refers to people like that, if you don't know. Some of the others that I think are important, they're not, like the initials, there are versions of the initials that are like the whole page long. So, and I think that stems from a desire to be inclusive towards however people identify themselves. But just so, and it varies, right? So what's used a lot is the plus at the end of it. So that kind of signifies that we want to be inclusive, but because this is an area that's evolving, we don't necessarily have all the terminology on a given day. So some of the others that I think are interesting, there's pansexual, which is a person whose choice of partner is not limited by the other person's sex or their gender identity or their gender expression. There's people who are gender fluid, so their gender varies over time. There are people who are asexual, so those are people who have no attraction whatsoever. There are heterosexuals, of course. The other one that you see a lot in different iterations of the initials is two-spirited. So it's often represented by the figure, the number two. And this is a term that was used by some First Nations communities, and it refers to what we would call lesbian, gay, or transgender people. But what it does, it describes a person who has a male and a female spirit, and they embody both of those. A lot of people were seen as special people within the communities. They had special powers. They were healers, artists, things like that. Transgender and transsexual, it's perhaps helpful to draw a distinction between the two. Transgender is someone who, it's a kind of an umbrella term for people who identify with the gender that's the opposite of what they were born with, or different from what they were born with, what they were assigned at birth. Transsexual is somebody who decides not only is their identity different from the body that they were born in, but they want to actually go and change that. So they'll go through the medical transition around that. The other two or three terms I wanted to mention, one was cisgender, which you had on your list. So cisgender is a term that's used more and more frequently. It's who identifies with the gender that they were assigned at birth. But cisgender doesn't mean that you're straight or you're gay. It's like a different variable. So for example, for me, I'm queer, but I'm a cisgender male because I'm comfortable with the body and the body identity that I was born with. Intersex is also something you see a lot. So it's a person who's born with biological apparatus that's either or a combination of the body parts of males or females. And they don't conform necessarily to typically what's expected of a boy or a girl. The last one is something that's emerging more and more recently. It's the notion of non-binary. And it's someone who, in their gender expression, so how they dress or how they behave externally, it's not male or female. It could be a combination of both, or it could be neither. So that person, chooses to express their gender identity in ways that don't conform to the male or female, what we call binary models of male or female.
Great. So we've gone over a bit of the letters. So to get to there, we had to have, there's some history behind that. We're going to get into a bit of the medical history. The DSM is, well, you know what? Do you want to explain what the DSM is? Just a very brief definition, and then maybe how homosexuality changed, when maybe it changed in the DSM, and where it's at now.
So the DSM is a manual, a sort of guideline that a lot of psychiatrists use. It's a way to categorize certain mental health disorders. It ranges from most commonly known major depression, anxiety disorders, schizophrenia, but also some disorders are related to sexual identity as well. So we're going to talk about it later, but there's also gender dysphoria is in there. Now, back in the days, homosexuality was actually in the DSM. Back in the days, being homosexual was considered a mental illness, and there were major repercussions of that. Not only, was there increased stigma, but there were actually therapies such as like a conversion therapy. So what that means is that so when you were diagnosed with homosexuality, you'd something that could be proposed was a therapy to convert you into a heterosexual. So that had terrible repercussions on the community itself. So luckily, they removed it from the DSM when they understood, or when society understood, that homosexuality is not a mental disorder, but is just a part of the spectrum of human experience.
Do you have anything to add to that?
No, I think that's
Great. Perfect. So we're talking about the DSM, and you mentioned a lot of different mental illnesses and mental health things and disorders that are in there. Is there more of a prevalence of mental health issues in the LGBT community? And do either of you want to like talk about that a little bit?
Sure.
Yeah?
You want to start?
You want to start? Yeah. We'll go back and forth a little bit.
Yeah, we'll go back and forth. Just jump in if you think it's. I think it's certainly in terms of a lot of the research I've done, and we talked earlier on about Dans la Rue, for example, which is an organization in Montreal that works with youth. And certainly they report, as is reported across Canada, that the prevalence of LGBT youth in homeless youth is significantly greater than other youth, the non-LGBT youth. It's the same, I think you were saying, for Indigenous youth as well. I think, the issue about non-judgmental healthcare, it goes back to, there's all kinds of issues I've seen in Montreal. A long time ago, I was involved in a McGill University research project where they were kind of mapping healthcare and mental health services across the city, and the availability and accessibility for LGBTQ plus population. And there were a lot of issues that were coming up in terms of, the best example I think of, there was an initiative for men who had sex with men around the time of the AIDS crisis. And so there was a lot of stigma around, if you were HIV positive and so on and so forth. But there was a need to raise awareness around safer sex and things like that. So there was a lot of materials that were published, pamphlets and things like that. And then they were distributed across the city in clinics and social services centers, things like that. But then one of the things we found out in doing, this kind of needs survey is that when that kind of information was distributed, it was put out in places where it was difficult for somebody who hasn't come to the point where they're able to feel comfortable about their gender or their sexual identity. They would need the information to protect themselves, but they'd have to go into like a waiting room full of people where there was a wall of pamphlets, and they would go to the area where there were LGBTQ plus pamphlets. So just walking into the room, you were obliged to kind of out yourself when you weren't ready to do that. So there are a lot of issues like that around getting access to healthcare. Also, there's phobia that's present in the mental health care and the healthcare system. I remember I worked in Ottawa for a long time, and then I needed surgery for an issue that I had. And then what I realized is, as I was going through the steps, the doctor that was treating me was homophobic. So he asked me questions during the interview that were relevant. He says, well, you have earrings on. Why are you wearing earrings? And it had no link whatsoever to the healthcare needs that I had. So obviously there was an issue there, and the issue was that he was homophobic because there was no link to, he asked me if I was HIV positive, which I think was a fair question because there was surgery involved. So I said no, which was true. And, but he felt the need to point out my earrings, and I think I had jewelry on as well. I probably was looking non-binary that day. And then he had a lot of difficulty with that. So I felt very, very uncomfortable in that. So particularly for someone who's trans, like for trans-identified people, there's a lot of issues with healthcare, certainly in terms of my experience. With the trans people that I know, access, availability is one thing. Legally, trans-identified people have the right to access medical care and mental health care. The problem, though, is there's one thing to have the right, but then in reality, there's all kinds of obstacles. And again, as I was saying in my example, if the practitioner that you're meeting is transphobic, then it's very difficult to establish a relationship with that medical practitioner.
I'm going to jump in here. You're a practitioner, yes, or practicing. So in your colleagues do you think there's any, how, do you have any input about that? Like with who you see going through med school right now and who's recently graduated, and is this changing or is it still the same? It'd be good to hear that from the inside.
Yeah. Good question. I'm going to answer that question and then I'll get to the prevalence of mental health issues as well. First of all, I'm sorry that was your experience. It is true that I think maybe in the older generations, there still may be some of, there definitely is homophobic attitudes. I think I can confidently say that that is changing and that has changed already. It's already part of the curriculum to talk about sexual diversity. Not enough, in my opinion. And I think being an advocate and being a representative in the medical system, it's my job, and not just mine, but my colleagues as well, to advocate for more education on sexual diversity. But in psychiatry, definitely, we do get classes as residents, so we do get training. And just to get back to the prevalence question of mental health issues, so there have been studies of prevalence in the United States and in New Zealand as well. And definitely they were able to identify that there are higher prevalences of mental health issues, the common ones being major depression, anxiety disorders. I think they were saying for men, there was more major depression and more panic disorder. So panic disorder is having sudden panic attacks out of the blue. That you can't control and that really have an impact on your functioning. Sometimes people can't even leave the house, or they have to avoid certain mundane interactions just because of these panic attacks. For women, there are higher rates of generalized anxiety disorder, so that's sort of a debilitating worry about everything, to the point that, again, not functional. There are also other mental health disorders that are less talked about. So like body dysmorphia or eating disorders, like obsession with appearance. But I think to a certain degree, everyone sort of cares about their appearance. But I think in the LGBTQ plus community, there is sometimes an excessive preoccupation with the body, to the point that it really affects self-esteem and even functioning sometimes. And substance use, abuse, yes. It could be dependence on alcohol or other drugs, but it can also be just occasional abuse, but that can lead to really terrible repercussions, overdoses, even death sometimes.
As you were talking, the other thing I was thinking of is a lot of the work has been in groups of people of color. So I think also if you're LGBTQ, I mean, I identify as queer, and one of the reasons for that is that when I was younger, I started sort of going out and then looking at, literature, magazines, and so on and so forth. In terms of the images that you see in the media, there's nothing really that I could identify with. It was all white men in their 20s, just with perfect bodies, and I just didn't see myself in those images. And so I think for people of color, and then also for LGBTQ youth who are from immigrant families, and they're also adapting to the environment in a new country, in a new context. It's certainly things that I've gone through myself. One feels very torn between loyalties. So, and I think that contributes to a negative impact on your mental health, potentially, right? So I remember feeling very kind of, who am I? Like there was a long period in my life where I was going through that. So you're kind of turned like, am I, for example, I'm of Indian origin. And then so it becomes this kind of, you kind of have to tear yourself into small pieces. So part of me is Indian, part of me is queer, part of me is not, and I have to kind of fit in, and I have to get a job and get a life and do all of this stuff. So then you're kind of left trying to figure out who you are in the middle of these pieces of all kinds of stuff that don't fit together. And I think in the lot of experience I've had in community work, that has significant impact, particularly on youth, because you're at a point in your life where your identity is emerging anyway, and then you have these additional challenges that are thrown at you. And, you know, if, for example, if you're from a culture where, I don't know, your parents are not necessarily super well informed about, you know, what, you know, sexual minorities are, how, you know, if you've got a sexual identity that's something they're not familiar with, like, should it be cause for concern or not? So that can create situations that are very, very difficult for the young person to figure out, who am I in all of this? Where do I belong? How do I fit in? And that creates all kinds of problems.
Yeah, I think everything you named. I mean, you're not the only one that's going through that. Very common dilemmas, identity questioning is very common, and of course, I think it's important to talk about depression, anxiety, and substance use. But it's also, I think, we need to expand the dialogue, the conversation to just to identity and relationships and the impact of discrimination on these as well. I think you're naming very important things, and I think there's actually a term for like an umbrella term for what you're describing. Minority stress is being part of a marginalized minority group, whether it be color or being queer. I'm using that as an umbrella term. It really does have an impact on one's self-esteem, one's sense of belonging, the questions that you ask: who am I? Where do I belong? Where is my sort of allegiance, my family, society? Where do I find my community? Where do I find people like me? All these questions are very common, and they do have an impact on mental health. Yeah.
So just to kind of give a little bit, I guess, a little bit more to that in terms of like stigma and everything, even within the medical field, there's still policies in place for men who have sex with men can't donate blood. Still to this day, if you've ever had sex with a man, you can never donate blood. That's across the board, and you know there's a big fight for that policy to be changed because it's an old, outdated policy. But you know, and imagine if you know you're trying to do something good, and you're being told, and you're freshly able to donate blood, and all of a sudden, no, sorry, you're not allowed to. You've had sex with men, and that's that's one of the small things that impacts how you view yourself and how you view yourself in society. A lot of really good things you guys are bringing up. I just want to let everybody know who's watching that we are happy to take questions. If you have any questions, while these two are professionals in their fields, anything they say is obviously not medical or legal advice, but they'll do the best that they can to answer any questions you may have, and we're happy to answer them. That's part of the advantage of modern day technology and being able to do this live. I had a huge list of questions, and we've kind of like touched a little bit on everything. So maybe what I'll do is get into some of the root causes. You guys kind of got into this of why the prevalence is higher of this of mental health issues in LGBTQ youth. If you think you can touch on some of the root causes of why that is happening, you guys have touched on it a little bit. Either of you have anything you want to start?
I think I touched on that question. I mentioned about minority stress. So, but if I elaborate a bit more, there actually have been studies on minority stress, and I'm glad that they're researching the impact of social discrimination and stigma on mental health. And what they found was that this minority stress, so the feeling of being different, of the worry of not belonging, the actual external discrimination, or the sort of internal discrimination that one has. And what I mean by internal is often people who are marginalized, they will face discrimination, and then they will sort of integrate that into their own way of thinking. Thoughts like, "Oh, I'm not good enough. I don't belong. I don't look like the role. I don't see any role models out there. I don't look like the people I see that are celebrated in the media." These messages sort of feed into common disorders like depression, anxiety, substance use, compulsive sex also, which can also be an issue. Is trying to find oneself through sex, but which could be a great thing, but can also, if done the wrong way, or like unprotected sex, or not being mindful of the risks exactly, could also lead to not only physical repercussions but also psychological repercussions as well.
So we have a question. Mark is fielding our questions over here off the out of frame.
This is a question from Nadia. Okay. How does homosexuality have anything to do with hormone disorder?
Okay, so I'll repeat that. The question is from Nadia. Thank you for asking. Is how does homosexuality have anything to do with hormone disorder? Is that, yeah? Okay. Do either of you two maybe have anything that you can touch on?
Sure.
Yeah.
So I actually never heard of the term hormone disorder, but there have been research or questioning on where homosexuality comes from, and people thought psychoanalytically, hormones, genetics, is it the environment, is it socially, and a bunch of people came up with theories, but I think no one has an answer, and at the end of the day, it's who cares? Because what are we going to do with that information? Are we going to try to prevent homosexual? I just think that question of where does it come from is a little bit irrelevant. There hasn't been any conclusion if homosexuality is related to hormones, but these are all things that have been looked at. Mm-hmm.
Cool. Anything else you wanted to add, or all right, I'll go to the next thing that I've got here on the list, which is so we talked a bit about this as well, which is how members of the LGBTQ plus community have limited access to healthcare, specifically non-judgmental healthcare. Legally, yes, everyone has access to that healthcare, but then there's the actual real life experiences that people have, which you went into briefly earlier, is one of many stories that happen. Do either of you want to touch on that a bit more about like limits to access?
I think there's layers to it as well.
Yeah. Okay, here we go.
So I think in terms of access, it's like you're right. We've all said that, legally in Canada, you have access to medical services. I mean, that's a given. I think that's the way it should be. But there's all kinds of complexities that come up when you're accessing those services, like the example I gave earlier on. Another example I could give is, let's say you're somebody who is not at the point where you've reached a level of comfort with your own identity and who you are. And you're functioning in society, you have a job, you have an apartment, whatever, and everything's economically or okay. But you haven't told anyone who you are or what's happening inside of you. And so when you're seeking medical help, if the medical issue is a function of your being LGBTQ and you're not out, then when you're seeing the doctor or the medical practitioner, you have to there's a call that you have to make at that point. It's like if you've never kind of had the support to yourself to tell people who you are, if you've got a medical emergency and then it's a key piece of information that the medical practitioner needs, you might not be ready to kind of declare that at the point you need the medical care. So that's one challenge. The other challenge is like the example I gave you on. Like I never really had any huge issues about declaring that if there's a medical issue that's related to that. The issue I had, as I was explaining earlier, is homophobia on the part of the practitioner. So I think those are two situations that are probably more common than they should be. The other one is certainly, as kind of we've said in response to the question that was just asked, a lot of this, the science in sort of sexuality and gender and so on and so forth is still evolving to a large extent. And so sometimes we don't have the answers either. So I think those are some of the kind of areas where there may be issues that people would run into. And that's probably why we have a lot of, not enough, but like support groups across the city as well, where if you are in distress or in crisis, there are places you can go to seek help. So I think places like AMI-Quebec, I think it's really important that those kind of organizations continue to exist in the city. The challenge on that level is with the whole funding structure and things like that. It's like the need is probably higher than what we have available right now.
So you brought up an interesting point about people being afraid to disclose things. Do you have any experience with that in practice on the other side of that? Or any stories or examples or anything like that that you could share?
Sure. I don't have any specific example that comes to mind right now. I will say that coming from the medical side, trainees are trained to be aware of certain physical or mental health issues related to the LGBTQ community, and that most STD clinics, for example, are very well trained to address certain issues. I do see a lot. I have seen some patients in my clinic come related to distress related to their sexual identity, sexual orientation. So yeah, that does make me think of an example. I won't talk about it just in terms of the confidentiality, but just to say that I think it probably is becoming more and more common, distress related to sexual identity, sexual orientation, and mental health practitioners in general are nowadays more comfortable addressing these things.
So just gonna touch base with everyone following along again, just letting you know I'm Tony from AMI-Quebec, and you're watching with Viet and Himit about LGBTQ and mental health. We've been going over a lot of different topics, and we're kind of going into right now the limits to access to non-judgmental healthcare in the LGBTQ community. One of those issues is access for trans people to have access to healthcare. So in the DSM, it was changed from gender identity disorder to gender dysphoria. Do you think you could tell us a little bit about that?
So the DSM-5, which is the most updated version of the DSM, now calls it gender dysphoria, which I agree with this new terminology. So what gender dysphoria is distress related to one's gender identity. What that means is one's biological gender not matching their what they identify with, and having either great distress or having that really affect their functioning, like not being able to leave the house because they're so distressed. And I think the word gender dysphoria, what dysphoria means is describing this intense sadness or this distress related to the gender. I think is a more appropriate term compared to gender identity disorder, because what gender identity disorder what that could imply is just being trans is an issue, or just having your identity being not conform to your biology, having that be an issue, which it shouldn't be. It's not the case. It's really the distress that is what we want to address. So now it's perhaps because of the old terminology, a mental health practitioner would have diagnosed someone who is transsexual or someone who is non-binary as having gender dysphoria, which sort of pathologizes an experience that is, not only common, but that the person has accepted or is legit and has no issues with. So now they just changed the terminology for better, I would think, because now we're looking more at the distress rather than just the non-conformity. Mm-hmm.
I just wanted to add one thing to that.
Absolutely.
Just on the legal side around that, a lot of, issues around obstacles or challenges to living, to be able to live life, to fully realize yourself authentically. There are changes that continue to be made to the Canadian sort of legal framework to better to be more inclusive and understanding of some of these realities. So one of the things I talk about in the workshops that I've done in the immigration department is there were changes that were happening at the time to the charter. So for example, there were two additional grounds that were added to the charter under which you can't discriminate. And those were, I'm just kind of looking through my notes. I think one was gender identity and the other was gender expression. So those are aspects of gender identity that weren't in the human rights legislation before. I'm just going to look it up so that I have the right reference. Okay, so it was Bill C-16, which is now part of the law. And now is an amendment to include gender identity and gender expression as grounds for discrimination, which are prohibited under the Charter. So in other words, if you're applying for a job and your gender expression is different from everyone else that works there, that can't be a basis for not giving you the job if you qualify for it in terms of the competencies that you demonstrate. In the federal government, for example, there are all kinds of policies in place to try and prevent that kind of discrimination from happening. So when you go through the staffing process, for example, when you create a position and you're looking for candidates to fill that position, the way it works in the federal government is it was always like this, but it's evolved, and now it's at the point where typically what they do in the federal government, it's based on the competencies. So when you develop a position, you identify what the competencies are that you're looking for, and then that's what you use in terms of your selection process. It's not how old the person is, it's not what gender they are or race they are, stuff like that. It's somewhat more scientific. And so you look at what are the competencies that went for this position, if whatever that person's wearing in terms of how they express their gender identity or however they behave or they speak, it doesn't really relate to the competencies that you're looking for to get the job that you want done well. So there is an effort underway, and the space workshops that I was involved in was kind of the same thing. It's just this mental awareness around, okay, and some of the workshops I did with management teams. So it was really interesting doing that. So getting managers aware that, oh, I've got this bias. And then you kind of bring them to understand that, when you're making a choice, the choice should be about, here's the competency that I'm looking for to do this work. That's really what I'm looking for. If I find someone who has that, whatever they look like or however they carry themselves or however they speak is irrelevant. What I need is that kind of competency that they have, which is going to make sure that the job that I want done is done the best way possible. So there's still a lot of work to be done around that, but it is starting to happen.
That's great. So Mark signaled to me that we have a question from someone.
Yeah, it's more of a comment.
Comment?
From limits to healthcare access. I'll paraphrase. I have an AFAB friend, so assigned female at birth friend, who went to a doctor about uterus problems. They're in the process of transitioning, and the doctor, healthcare practitioner, just assumed they wanted their uterus removed and completely disregarded the fact that they didn't want children at some point in their life.
Okay, so I'll recap that. I don't remember who Jody has a assigned female at birth friend who has a uterus, and went to a doctor, and they're transitioning, and the doctor assumed that they want their uterus removed.
Yeah,
essentially,
they had uterus issues.
they had uterus issues, and they assumed that the only solution, or the easiest solution, I guess, would be to just remove the uterus, disregarding any future ambitions to have children. Do either of you want to comment on that?
Yeah.
All right, there you go.
I think I think the least I can say is that's quite insensitive. I could say a whole lot more, but I think I'll just leave it at that. I think also it's kind of like we talked about earlier on before we started the session. There's this notion that you saw it in the evolution of feminism, this sort of emergence of the idea that women own their own bodies and they should be the ones who decide what happens to their bodies, which I agree with. And so I think for people, it's kind of like the next frontier, and it's kind of linked in some ways, perhaps, to the evolution of what happens with intersex people. For example, there was a period in the 90s when a lot of kids that were born intersex, the parents felt like they were doing good things, so they'd take them to see a doctor, and they'd have surgery done on the kids. So they would assign a gender medically to the child. And then as the child was growing up, there were cases where the child came to the realization that they had been assigned the wrong gender through surgery. So there is this kind of emerging notion in the LGBTQ population as well, that notion that you should have the right to self-determination around your body is really important. So for practitioners, I think there may be in some cases a need to kind of raise awareness about that again.
Yeah, I agree with what you said. I think in the healthcare system, we need to continue to advocate, to have this open dialogue about what it means to transition, because that can mean so many different things for people. I think it's a responsibility in the sense that healthcare professionals need to do better, to continue doing. We can always do better in terms of asking the right questions, how to ask the questions, and then the responsibility would be for the person seeking treatment to clearly communicate what they want, so that it doesn't become sort of a paternalistic model from the healthcare system where it's the doctor decides what to do with the person's body. I mean, that's really not what it should be, and I would say in general, that's not how it is. But I think the healthcare system needs to continue becoming more informed and having this open dialogue.
Also, I think the other sense I have that there's more and more intersex people who, or even trans-identified people who don't follow through with the surgery, because there's this incredible acceptance of what you're given physically, and just accepting that, and then just saying, "This is okay. This is me. Like, why is this wrong?" So I sense like I feel more of that. And there's actually a documentary that was done in Australia in the 90s, early 2000s around this issue, and what the research under that, I can't remember what it was called, but I think what the research under that documentary seemed to indicate is that over time, as people understand this, it's like, why is there a need to intervene surgically? If we can make the person, or help the person come to terms and accept, or if that's what they want to do, rather. And there's no sort of, and they're aware of if there are any risks or anything like that involved, then it becomes that person's decision and not the medical system or a social worker or somebody kind of telling them what they should be doing. And it's more sort of being supportive and then filling in any information or other gaps that the person may have, but ultimately letting them have the decision as to intervene or not. And then if you don't, then continuing to provide that support to say, okay, you've decided you're not going to intervene, and that's okay because it's your decision. And maybe you need a different kind of support now. And then how do we direct you towards that? I think those are some of the challenges that would probably come up through that evolution.
Do you want to add to that?
Yeah, I'll just briefly add to that. I think I agree. There just needs to be a continuous conversation and support through the whole process. I think it could be easy to sort of have one picture of what it is like to be trans or to be queer, and the medical system out of good intention may want to come with one solution, but it doesn't fit everyone. So but the medical system is aware of this more and more. There's more research coming out. So I think the main thing to do is really for medical practitioners to just to listen to the person. They have the experience, they have the real life experience, and to accompany them through that.
So I've been taking a few notes here about the kind of the next, you guys have each been saying really key things that I think are really important. I think you said you said about the medical system being a paternalistic model. Yeah, you may have commented on that. And then you mentioned about people having self-determination about our bodies and how that's very important. And that the person's decision should be supported by the medical practitioner rather than insisting on a medical intervention, for example, or using a medical intervention as the solution. And I think the key you said was listen, and I think that's the most important part about it. And I wasn't sure I was going to bring this up, and I briefly talked to you about this earlier. So I'll bring it up and ask you what you think about it from the medical practitioner side, and then maybe you can comment after the fact too. So there was an article in the Gazette recently. I think it was yesterday. And it was someone from McGill saying that they should completely eliminate the psychiatric evaluation process that is necessary legally for someone to start transitioning, be that transgender, transsexual. You have to go through this process to start hormone therapy, to start regaining anything. And I kind of want to touch on that a little bit, elaborate on that a little bit more in terms of the legal processes and how that can impact someone. But I'm interested in what your opinion on that of eliminating that process entirely of the psychiatric evaluation being necessary, especially when we look at it in terms of the things we've talked about earlier in terms of non-judgmental access to healthcare and how why someone who, a 60-year-old man who's never had any experience with trans people gets to decide essentially if someone is ready to transition.
I think it's a very complicated issue. As usual, there's never it's never black and white. Black or white. Yeah, I think the issue is that with a psychiatric assessment or a psychological assessment comes a lot of delays in the transitioning process. So for people for whom it's clear that the transition is there's the solution for their mental health and for them to be who they are. I think for others, for some people, that the transition process, we talked about it earlier, is arrested. They stop at some point. So I think it is important, on the other hand, for people to be accompanied psychologically through the process. But then, as I said, for other people, it's so clear that this is what they need, and that the psychiatric assessment can delay the process, can also be traumatic for the person that it's like their identity is doubted and needs to be evaluated. So I think just psychologically, that's a damaging process to go through. And again, I feel like there's no one clear solution. It's case by case. And then I think everyone needs to develop more expertise and more comfort with this topic to be able to tell, to understand the case, understand the person. Mm-hmm.
You have any comments about this?
No, I agree with everything
Yeah?
you said. I think
Perfect.
it's right. I really think it's on a per person basis. There's really a need to kind of almost customize what you're offering to the person.
I think I liked what you said about how some people might need to be accompanied through the process. I think that's a very I don't know, it's a kind way of putting it, rather than it being like an evaluation per se.
I think it's a key, because if it is an evaluation, then ultimately the person can feel like, okay, it's the state that has authority over how I kind of manifest myself. And to me, that's really problematic on all kinds of levels. So.
Okay. Cool. That was that went a lot smoother than I thought it was going to. I'm looking at my list here to see, is there anything that either of you think is like a good thing to bring up or talk about, maybe? That I have a couple more things on my list, but just open it up for you guys.
I was going to perhaps talk a little bit about intersectionality.
Oh yeah, okay, there we go. Go ahead. You want to tell us what intersectionality is?
Yeah, intersectionality, says he looking at his notes. But basically, a better way to explain it is to kind of personalize it a little bit. Like, the reason I identify as queer, as I was saying earlier on, I didn't see myself represented in the images that you had of the gay community in Montreal. So then I was in a collective of kind of South Asian queer artists at the time. And the term queer, this is like 90s. The term queer is emerging, and it's queer as a term where you kind of reclaim an insult, basically, that was used to kind of, in a derogatory way, towards people who you know. So it's kind of reclaiming that. But I mean, the reason of using queer is that my identity is my homosexuality. Like, that's really fundamental to my sexual identity. But then, I'm not skinny and white and 22, and I don't walk around in a Speedo all the time. So, and my identity is constructed from other things as well. The race is a part of it, my culture is a part of it, my language is a part of it, my socioeconomic status, my status as an immigrant, and then later as a citizen. So all of those things combined together make up who you are. And then what intersectionality, the theory says, it's a theory that was out of feminist studies, gender studies rather. And what it says is that people can experience marginalization or discrimination on multiple factors. It's not necessarily just, your sexual identity or your racial identity. It could be a combination of those things. And so I think it's really important to kind of be aware of that, both for the person who's LGBTQ. I think it's useful to kind of maintain that awareness, because when you go through social situations where you kind of feel, ooh, afterwards. I mean, for myself, I've often gone through a process where either been subject to discrimination or whatever, and just say, okay, why did that happen? And then you go through a process, and then sometimes when you've eliminated the reasons, you're left with like 2 or 3 reasons. Is it because I'm gay, or is it because I'm brown? Is it because I'm an immigrant? And then so that kind of analysis, through that analysis, you identify what those factors are. Enough me who identify as queer, there are multiple factors at play in terms of the barriers to access of all kinds of services and privileges in society. The other thing I was going to say is make a reference to, it's kind of veering away a little bit, but just the whole issue of hate crimes in Canada, because I think it is connected. So in the federal government, we do look at, hate crimes across Canada. And there is a database that's maintained by Statistics Canada. So you can just go online onto this Statistics Canada website and look at the hate crime section. So if you look at the hate crime section, I took the latest version. So if you look at, right now they have sexual orientation as one of the bases for hate crimes. So hate crimes, because we're in a kind of a global environment where there's all these kinds of movements at play. There's a rise in, authoritarianism, if I can call it that, in terms of, there's a lot of, the alt is taking a larger and larger place in the political space. And so when you look at hate crimes and the way they've evolved, I think it's kind of linked to the kind of environment that we're in. If you look at, different countries, Brunei, I think it was, that just enacted legislation saying that if you're, I forget how it's worded, but if you're queer, if you're homosexual or whatever, you're subject to the death penalty, right? And there's whole swaths of Africa now where LGBTQ plus people are in very great danger. So in Canada, we're in Canada, you think it's a relatively safe country. In 2014, there were 155 hate crimes around sexual orientation. In 2017, there were 204. So it's a significant increase. And if you look at, to link intersectionality, if you look at race or ethnicity, for example, in 2014, there were 611 hate crimes reported. In 2017, there were 878. So if you have someone who has multiple aspects of their identity, a lot of those aspects form the list of the basis on which hate crimes are committed. So if you look at trans people, for example, they suffer a lot more incidences of discrimination, violence, and so on and so forth. And that has to do with the intersectional nature of who they are. And people who are brown, who are immigrants, or, people who have low income or who have disability, with the combination of factors that can lead to hate crimes, these people were more vulnerable in that sense. So I think that's something also to kind of keep on your radar. It's really important to have a sense of that.
Awesome. I definitely have a lot to comment about that in a second. Mark has a question for us.
Okay. What would you say to someone who says, and I'll put this in quotations, if someone says this to you, why do you need to advertise your sexual orientation? Why do you need to be accepted? Just accept yourself and all will be fine. So many people are not accepted for how they are. Why do you need to have a parade, put it in our faces? So why do you need to advertise your sexual orientation? What do you say to someone who says that?
Okay, so the question is, I'm going to paraphrase that because it was pretty long, is why do you need to advertise your sexual orientation? Do either of you want to take this?
I can start.
You can start? Okay. I will be angry if I so I probably should.
I'll give my point of view, and it's mine, but I think it's also one that is shared. I think I wouldn't call it advertising, but I think the question refers to parades or pride events, and why is that important for the community? The question is why is accepting oneself not enough? Why does it have to be shown to the world or shown to others? I think the importance of these pride events, these parades, is to celebrate or to empower a community that has felt disempowered or ashamed. So, and it's to send that message to other queer people that you can celebrate, be proud. It's more of a supportive event. I see it more as a supportive event more than a advertising event. Although I do think that advertising and marketing can spread this message of support and of empowerment. So that's how I see it.
I agree with that, everything you said. I think also what I would add to that is, and again, I make the comparison with, the struggle of women. in terms of, feminism, I think that sexual minorities do have a struggle. And then young people who realize that they belong to a sexual minority, it can be an extremely difficult and or dangerous thing to do, to kind of accept and then be who you are authentically. And I think I agree with what you're saying. I think where pride came from is that history of those oppressions. And then people who are LGBTQ or who belong to sexual minorities saying, I want to kind of lift this oppression from myself and I want to kind of be who I am authentically. And so if you're walking along Sherbrooke Street on Pride Day in full view, it's very empowering, particularly if you've been hiding away who you are for a long time. I mean, I know for myself, when I came out, that was one of the things I did for a few years. I would participate in the Pride marches every year. And I didn't really feel like I was advertising anything to anybody. I'm not really sure what I had to advertise, if that was the case. I think for me, like you were saying, it was more around, okay, I feel quite comfortable with who I am. And it's broad daylight and we're on Sherbrooke Street, but you know what? I'm good with who I am and I feel good about this. And that would have been like late 80s, 90s. And I think the world was a little bit of a different place then. The other part of it, I think, and maybe it's a comment on marches, and you may have stuff to say on that, both of you, but I think there was a period when they became really commercialized, and I think part of the reaction was to that as well. It's like, why do you need this big truck with a beer company's name on it? And then why do you need 10 of them in the parade? And there are other issues that are emerging through pride parades as well, like who do we include in them and why not, So, but I see the pride stuff more as inward looking almost rather than outward in a way, or both anyway. So, but it does fulfill a function internally towards the community. I'm calling it a community, even though I don't think it is, but it's a population more. But I think particularly for young people, if something like that's happening, then it kind of supports them in that process of accepting who they are and then living authentically in that identity. And I think for me, walking in the Pride March, I think I did it for 3 years, was like very empowering for that. I just felt it was okay for me to be out walking on the street. This is who I am. So that was like huge for me.
It's funny that everything you guys have said is like all in my little, like I keep jotting down notes and I'm like, oh yeah. And then you immediately say the next thing. Like the first thing I jotted down was celebrating versus advertising. And that was like the first thing you said is it's celebrating. I think another aspect of to bring it out, to specifically answer the question about like, why is it in your face? Why do you have to put it in someone else's face? Is that when people are part of a minority population, all they see is the heteronormative, straight, white, especially in Canada, demographic surrounding them. In the advertising, in the movies, in television, these are the primary things you see. So in terms of putting it in your face, it's kind of switching it around, right? It's like saying, you know what? No, we are going to put it in your face because you've been putting it in our face our entire lives. So for this one day, you have to deal with it. And sorry, not sorry. I have a whole lot of things. Anyways, it's funny because I have like, we were talking earlier about hate crimes and reporting, and then you were talking about Pride Parade, and immediately it's the police come into mind because that's one of the issues that's been very prominent, and reporting to the police as a minority, a member of a minority group, and how that affects you, and all of this all ties into mental health and I believe you call it minority stressors, and that's how all of this ties into mental health. So it may seem like this discussion is just based around LGBTQ and not mental health, but all of these things tie back in. They all connect back to mental health. And if you Viet mentioned earlier, there's high issues of anxiety and depression, and you have members of minority communities who constantly are receiving these stressors that you're seeing all the time. Like, is this cop gonna harass me because I'm a man in a dress? I show as a man, I have a beard, but I'm wearing a dress. Are they gonna harass me when I'm walking down the street because they have archaic views of what it is to be a man? Anyways, these are like, this is all the notes that I'm like jotting down here. Did you have anything else you wanted to say about to answer to that, and like tying back into pride and all of that?
No, I just wanted to.
Yeah, here.
I just wanted to. I agree with what you said about. No, just remind ourselves that we live in a society and a culture that's very heteronormative. That's what you're talking about. The images that we're exposed to growing up is of heterosexual love, heterosexual romance, heterosexual sex, and we've taken this for granted as this is universal. This is what life is about. But life is so much. There's so much more diversity, and there's been for a long time a lack of representation of LGBTQ plus role models, romance in TV. And so I think the parade is also, as you said, a way to say, hey, we're here, we exist, we should be as celebrated as these, I don't know, Brad Pitts out there. Yeah.
Well, there's also another dimension to certainly Pride in Montreal and in a lot of major cities now. It's become this economic draw. I think, for example, Pride in Montreal, it's like hundreds of thousands of people that come into the city now. So it's kind of interesting how the kind of material end of it has raised awareness in a way. And as I mean, when I went to university, I studied marketing. That was the area that I studied. And one of the things I was studying in a lot was like marketing to cultural communities. It was just emerging then as a thing. And then over time, as you know, it became this big thing. And then companies started making a lot of money out of marketing specifically to communities, doing what they call targeted marketing. So I think for the LGBTQ plus population globally, and certainly in North America, there's a lot of companies now that market specifically to us. And then Pride has become an occasion where there's this economic convergence around Pride. So it's turned it into something else. And that's also one of the reasons why a lot of people like me have stopped going, because it doesn't incarnate the values that it perhaps had, many, many years ago. And I don't mean that as a put down, but it's just that's the way it's evolved, for better or for worse. And I'm not sure that the economic route is the only route to go. I think it brought money into the city and into the businesses that service the community. But how much of that money then goes into awareness raising, social programs, other services to support us in terms of what we need and what we can't access easily? I'm not really sure if that's ever been researched very much.
All right. I'm almost out of topics. So if anyone has any questions that if they like.
There was just a comment, intersectionality, yes.
Okay, perfect. So someone was very happy that we mentioned intersectionality, which is good. Yeah, it's important. And it's pretty new, I think, in terms of like the way people talk about different minority groups and just the world in general.
The theory's been around for a while, but I think it started mainstreaming more recently. I think you're right.
Yeah. All right. So we've been talking about mental health. We've been talking about the LGBTQ plus community. Chances are everybody knows someone who fits into the LGBTQ plus community. I'm going to make that statement, and I feel comfortable making that statement. Yeah. So my question to you two is, can either of you explain who an ally is, or what the concept of being an ally is to the LGBTQ plus community? And if you can even tie it into mental health, great. If not, we can get into that in a little bit. But I think that the idea of an ally is something that maybe not everybody has heard of.
Sure. Yeah, would you start? Yeah.
Okay. Well, I took notes from one of the workshops that I gave where we did talk a lot about, what an ally is. And it's different things. It's a lot of things. Ultimately, if you want to be an ally, that impetus sort of comes from within. Like you're aware of something, an issue, and then you want to help, you want to contribute, you want to support, you want to be supportive. So I think that's a good thing. But it's more than just being sympathetic to people who are experiencing discrimination. It's being, present for them. So what it means is there's a willingness to act for and with others, doing work that ultimately will end the oppression that that person is subject to, and creating equality, or equal access to the extent that we can. The Dalai Lama has a really great quote. So it's not enough to be compassionate, you also have to act. So I think that's really important. So an ally is someone whose personal commitment to fighting oppression and prejudice is reflected in their willingness to do 4 things. The first is to educate themselves, so you're not ignorant and you don't say things that are insensitive and you don't behave in a way that's insensitive. So you educate yourself about what different identities are, what different experiences are, and so on and so forth. The second thing is to change your own discomfort and your prejudice. Because we have discomfort around other identities where there are aspects of those identities that we don't share. And it's important to kind of, your education is part of it, but then also identify your own discomfort. Why am I uncomfortable? And then why is that? Is there a good reason for that? Or is it an assumption, or is it a prejudice, or is it a bias? Like, what is it? And then once you understand that, then you do your work to overcome that discomfort or that prejudice. The third thing is you kind of learn and practice the skills of being an ally. So you sit with the people who you want to be an ally to, and you learn as much as you can about them. And then the last one is you participate in the action that they're going through. And that action is to create interpersonal, societal, and institutional change. What I would add to that, though, is the other part of it is to be sensitive to who the voice is, and that you don't speak for the person. You let them speak for themselves. And if they say something that you don't understand, then you find a moment where you ask them, okay, you said such and such. What did you mean by that? I need to understand. I want to understand. It's helpful for me to understand what you mean by that. So it's, again, that kind of relationship where you're open to learning from the person, understanding them, sort of identifying what the differences are. If you're uncomfortable with parts of who they are, then you sort of, it's like we do in mindfulness meditation. It's like you sit there with whatever it is that's inside of you and you try to figure out what it is. It's a little bit like that as a process. So I think those are the keys to, somebody being a good ally.
I agree with everything you said, especially the last part, because maybe a follow-up question to what is an ally, but the follow-up question could be like, how can I be a good ally? Like, how do I actually do it? And I think maybe a common reflex would be to, as you speak for the for the marginalized person. In doing so, in speaking for, speaking in the place of, it can actually sometimes disempower the person that is still maybe struggling to find their voice, to be able to speak up themselves. So I think it's important, as you said, to try to understand the person, listen, what do they need, give them the platform to do it if possible, but also to be mindful that minority groups, whether it be the LGBTQ community or being a person of color or being a woman, they've experienced throughout their life like microaggressions, trauma, and discrimination that makes it difficult for them to express themselves. It doesn't come as easy as, say, a heterosexual, cisgender, white male. So you really need to empower these people, help them express themselves, because it can be difficult. But it's important to go through that process of empowering.
One thing I wanted to comment on is you said it's important to educate yourself, and I think that is a very important thing, and you touched up on it. You added to that by saying you can ask people, like, questions. But I think it's very important to understand that people of minority groups shouldn't have to do the work of explaining all the time what their stance, their position, or this or that or this is. If you want to be a true ally, I think it's important to educate yourself in advance and come to them saying, "This is what I've read. Can you elaborate on that a little bit?" Rather than just saying, "So you wear a skirt? Well, what does that mean? Like, what do you mean by that?" Well, exactly, right? It's insensitive, and so and I think that's the key to being a good ally is not just assuming that because someone is part of a minority group, they're going to explain something to you just because you ask. That's again, that's not empowering. It's draining. Yeah, I wanted to add that in there. So if anyone has any last questions, I think we're going to kind of wrap things up a little bit on just how we can support people. And I think that you both have touched on that quite a bit. There are definitely organizations within Montreal. Obviously, there's all over the world, but I think we're going to focus on ones that are in Montreal. A few that I can think of locally that I think are very open for specifically mental health related things is AMI-Quebec, and you can always call us. I'll repeat this at the end as well at 514-486-1448, or check our website at amiquebec.org. And we have resources that we can tell people to go to. But another organization has a medical clinic that's open to LGBTQ plus community is Head and Hands here in NDG. And they've been around for over 40 years. And so they also have a very large list of resources that are available to the community. There's STEC in I think it's downtown. You also mentioned Dans la Rue, which deals with youth and homeless youth, essentially.
The other thing, I was thinking of Gay Écoute, which has changed its name.
Oh, yeah.
It used to be called Gay Écoute, and it was a phone-in line.
Okay.
It's now called Interligne.
Interligne.
Yeah,
okay.
So they have a lot of good resources.
Okay, perfect. Another organization for youth in NDG is Project 10. Right. They offer a drop-in center. So we're gonna probably post a lot of these resources a little bit later. Do you guys have any closing comments that you'd like to say, or?
I could talk a little bit about the support model that we proposed federally, because what we did is we trained what we called ambassadors.
Oh, perfect. Yeah. So here, why don't you explain that?
Okay. So in the Positive Space Initiative, what we did, the goal was to kind of make the working space a space that's more comfortable and safe for LGBTQ plus staff. And then also, through the process of doing that, raise awareness broadly about this population. So in the workshops, there was one that was like a 2-day workshop to train the ambassadors. So these are people that we put in each office. So I think I trained somewhere close to, not far off 100 altogether. But each office, certainly in theory, I don't know if in practice it's the case now, but the idea was to put an officer, an employee in each office who's been through the program. So they've received training and information around, a lot of the issues that LGBTQ plus people are faced with. And then one of the things we did with them is we presented us what we call a support model. It's basically based on, sort of social work kind of support generally used in community organizations. So there are 3 elements to that. And it's kind of links to allies as well. So an ally could use these kinds of behaviors. So there are three parts to it. One is sort of listening attentively and non-judgmentally. I think we've said a number of times now. So what that means is when you sit with someone, demonstrate that you're engaged, that you want to be there, and you're not there for any other reason, but like you want to be there. And then make an effort to understand. If something's complicated and you're not sure, ask questions, you know? Because if the person's down with you, that indicates there's a willingness to communicate with you. And then reflect back to the person what you hear. So that, again, that clarifies what's being exchanged. The second part of it is demonstrating support. You know, say to the person, like for example, in the workplace, what may happen is you have someone who's LGBTQ, who's on the verge of deciding that they may want to come out, and then they kind of go through this around, if I come out at work, then what's going to happen? I'm just using that as an example. So then demonstrate that support. You know, I'm glad you came to see me and talked with me in a safe space. It's quiet. We can close the door. Tell me, you know, whatever you want to do. Thank you for sharing that information with me. And I will keep this confidential. I'll respect, you know, your privacy. And I realize it's difficult or complex for you to talk to me about this, but I will protect this information, you know, however you want it protected. And the third part is in the dialogue, ask relevant questions. If the person's going through a crisis, we're not expecting the ambassadors to be like social workers or psychologists, because they're not. But like break a part of it down, and then if there's a need, you can refer the person. But then the third part of it is asking relevant questions. If something's happening, okay, what's bothering you? You know, tell me exactly what it is. Can you identify what it is? Do you know what it is? Who's there to support you? When you go home, is there somebody there? You know, do you have a partner? Are your mother and father around? Do you have a brother or sister? Are there friends? You know, if you're in a crisis, you don't want somebody to go home alone if they're going through some kind of a crisis. You want to make sure that they're, you know, that they're supported through that, so that there's not something bad that happens as a result of that. And then the last question is, what can I do to help? You know, what I should do to help you. And what a lot of us do, and I include myself in that, you should do this, you should do that, take this pill, do that exercise, you know, go have a shower, you know, have a bath. But don't do that. Ask the other person what they want, you know. So you direct it, again, that's the process of empowering the other person, even through their crisis. You kind of say, okay, something difficult's happening, I want to help, tell me how I can help you. And then you give the power back to the person. So that's basically the model that we present. And then we do a few kind of role-playing exercises with that. So we had the ambassador sit down with, you know, an individual that's coming in. That's going through, we had like 10 different crisis scenarios. And then how would you help the person? And then we used that model. And then we would do that in a sort of a very sort of informal way with the person.
It's a very great way of being an ally and supporting people. Yeah, here.
My final comment would be sort of adding to that. I think that's a good way of helping is asking the person how they want to be helped. However, I think for some people, from experience, they don't know how they want to be helped because they were never taught to ask for what they want, or they don't unconsciously don't think they deserve to be cared for, or they never learn to think about what they need and to ask for it, and they may expect it to just be done for them. And so my final words would be, well, one, go to your healthcare professionals. As much as I've said that there still is work to be done, I do still want the message to be that, you know, health professionals are, whether it be a psychiatrist, a psychologist, or a family doctor. Actually, the family doctor should be the first person one goes to for healthcare, is to talk about these issues, express yourself, ask the doctor or the healthcare professional what you need. It's easy to wait for it, to wait for the person to open up. Generally, I would say healthcare professionals are attuned to these needs now more and more. Sometimes that's not going to come, the person, for whatever reason. And I encourage everyone to really ask for the care that they want and to express exactly what it is they need, whether it be for transitioning or for STD screening, for if it's just support, someone to listen to them, then it's a two-way responsibility. Mm-hmm.
Excellent. Well, thank you both for all of your fantastic input. And if you have any questions or need resources, you can always check the AMI-Quebec website at amiquebec.org. You can also reach us by phone at 514-486-1448 and come out to our AGM on June 11th. It's a big day for us. Yeah, thanks.